The treatment goal for early stage breast cancer is to successfully treat the cancer with the least amount of treatment. That would be our ultimate goal. Surgery is still an intricate part of what we do. We are actually doing less and less aggressive surgeries, which is good news. The two main categories of surgery to treat breast cancer are breast conservation, where we're saving the breast, and mastectomy, where we're removing the breast, usually with reconstruction. In addition to surgery for breast cancer, we have other therapies, chemotherapy, radiation therapy, and plastic surgery if needed. Hormone therapy is a therapy where we are trying to eradicate estrogen from the body, or we are blocking the estrogen receptors that are present on the cell surface of a cancer cell. If we can block those receptors, or we can eradicate estrogen so that that cancer cell is not stimulated, that cancer cell will die. Chemotherapy is a treatment where medication is given through the veins. So they often target cells that are rapidly dividing, and that's why people lose their hair, because hair cells are rapidly dividing. Nails, their nails stop growing. That's why they get nauseous, because in the GI system, you have cells that are sort of turning over rapidly. Targeted therapy is a kind of treatment where we try to look at the features of a tumor and specifically gauge our treatments to treat that particular tumor. So there's a lot of factors that go into making that decision. It's sometimes based on genetics, sometimes it's simply based on the features of the tumor, but it's basically a discussion that you have with a medical oncologist to come to a conclusion as to whether or not it's beneficial. If you have a question about your treatment for your breast cancer, the person to talk to is either your surgeon, your medical oncologist, or your radiation oncologist.